With rising COVID case numbers, increased demand for testing, and a continued push to get more people boosted, we want to keep you informed with all the latest information as we continue to move through this pandemic. We are joined once again by Trinity Health of New England's Dr. Syed Hussain. Dr. Hussain, thanks so much for being with us.
Thank you for having me.
All right, let's start here. From a medical perspective, what are your thoughts on the president's push for getting additional masks and at-home testing kits out to Americans?
It's welcome news. We need as many test kits as possible to get over this period of the pandemic. We know this virus is peaking, perhaps peaking in some areas, especially the Northeast, but other parts of the country definitely would benefit from both testing and proper masks as well.
Now, if we didn't have such supply issues back in 2020, do you think would earlier access to N95S or KN95 masks change the course of where we are right now?
You know, that's hard to say, because if you look at where we've been now over the last several months, we've had ample supply of all types of PPE, including N95s. It's compliance that has gone down. We don't have any more mandates related to masking. There's fatigue related to following public health measures. But all of the equipment, the supplies have been there. So we could have technically had a lower rate if people followed masking guidance and followed other public health measures.
Now, for those getting vaccinated and continuing to get sick or watching those around them get sick, how do we encourage everyone to get boosters? Because they might be saying, hey, I'm just still going to get sick. I'm still going to get this, even if I get vaccinated, even if I get boosted.
So that's a great question. And I'll tell you why. Because the vaccines were designed to prevent severe disease, hospitalization, and death. They were and not necessarily designed to prevent infection. Now, in people who have breakthrough infections, those that are vaccinated and come down with COVID-19, they tend to have either mild symptoms or no symptoms. But if you look at who's getting admitted in our hospitals around the nation and in Connecticut, a majority of them, I would say more than 70% of inpatients with COVID-19 are unvaccinated. Again, it points to the efficacy of these vaccines in preventing those dangerous complications.
Dr. Hussain, I want to switch gears just a little bit, shifting from COVID to the opioid crisis that we're dealing with. As you know, we had a 13-year-old boy here in Hartford sent to the hospital. He's in grave condition just now, at last check. Because of exposure, police are saying he overdosed on fentanyl. For those watching at home, maybe they're not familiar. How potent is fentanyl, and how much has this increased the opioid crisis with young people since COVID began?
So this is an ongoing tragedy, probably gotten worse during this pandemic as we've switched gears and focused more on COVID-19. But this is one of those things that we really need to address. And fentanyl is a very, very potent opioid medication, pain reliever. It's usually used after surgery or in active cancer. It's 80 times more potent than morphine and hundreds of times more potent than heroin. And so folks need to recognize what those symptoms would be if there is a possible fentanyl overdose. Pupils that become small. There's respiratory depression, so breathing is a problem. Altered level of consciousness. Patient may have fainted or may feel dizzy. You need to call 911 immediately, because there is a medication to reverse symptoms of a possible overdose almost immediately.
Oh, doctor, thanks so much. We really appreciate that. I think it just brings home the message that we've said so many times regarding this is to talk to your kids, right? Especially now.
Absolutely. Absolutely. No question.